there, next up is Henry O'Connell of Canary Speech. Henry, can you hear me?
Yeah, we can hear you. Very good.
Perfect, perfect. And so I'm going to make the account you have that is speaking right now host, so that way you can share your screen. Do you have audio or video with your talk?
No, it's just
So you won't need to worry about clicking the little box at the bottom. Okay, I'm gonna hit make host. It's gonna make you the host. Okay, so now you're host. So now you can share your screen through the button that you ought to see appear at the bottom.
Sure.
Okay, cool. So Henry is CEO, founder of Canary Speech. Henry, thank you very much for being part of the Voice of Healthcare Summit with us. Okay, so you just maximized your slides there. I'm going to go on mute. Take it away.
Thank you. And Mark, thank you very much. Wonderful presentation. We've had the opportunity to work with Mark and with his team, and I can tell you just absolutely a class act. We really do appreciate it. Canary Speech is just proud to be here, guys. We're just proud to be part of this. We're proud to have the opportunity to participate in such a good thing. Our talk is around reducing risks through hidden data in our speech. What I want to do is I want to talk a bit about what we have identified as opportunity within speech to get more accurate, more detailed, and more real-time information that can provide to individuals, both personally and to a clinical team, the ability to make decisions more accurately about our welfare and our health. All right. It's a little bit difficult to talk about oneself, but I have a number of years of experience in both technology companies and in health and wellness and in a clinical environment. I began my career after graduate school at the National Institutes of Health, working in a neurology disease group, and met my co-founder, Jeff Adams, at the time. He was at the NSA doing just great work in protecting our country with respect to the Cold War at the time, decrypting messages, using mathematical models. And you'll see as we go forward that early work that he was doing, he then went on to a lifelong career in speech and language. I went on to a career in technology and healthcare companies. What we do, and when we talk about the hidden information in voice, what we're really talking about are utilizing information well below the top level, well below the word level or the spoken level. We've identified 2,548 features in speech that are fundamental to how the central nervous system creates language. I'll talk a little bit more about that in the coming slides, but every 10 milliseconds of audio, we take a sampling of 2,548 features, which means that every second we're capturing about 250,000 data points. If we focused at the word level during that same second, we might pick up a word or two. Speech is very, very dense in information. That density lends itself to analysis by machine learning and the development of models that could be used to provide information about an individual's wellness, about a range of different characteristics, things like stress and anxiety, Alzheimer's, Parkinson's, cognitive. Mark was talking earlier about isolation and loneliness, detachment. All those things can be assessed, measured in conversational speech. And what Canary has done is to develop the capacity to create language models for specific things, and then to analyze conversational speech in real time. The way we do this is to identify and extract these features from audio and from speech. We use those features to create algorithms, and we train those using machine learning and AI. Once those models have been developed, they can be deployed and analyze speech across the population and longitudinally look at changes in individuals' temperament, their mood, their cognitive functions, stress levels, things like that, so that we can have information that augments the kind of things that Constant Companion is collecting, and provide a richer set of information for both the individual and for those that are caring for them. And we can do that in normal conversational speech that they're having in an environment where they're living, their home, or in a care facility. I just wanted to talk a little bit about the complexity of speech. This comes from a paper printed in 2015, and the reference is at the top and the bottom. When you think about speech, and you go down to the vocalized speech, historically, the focus has been on analyzing vocalized speech, the tonal elements of it, the actual words that have been spoken, the gaps, filler words that individuals might use as they're thinking or trying to process. What Canary recognized was that this entire process could be monitored, that the data could be mined, and that we could use machine learning to then analyze in a much deeper way what was going on as an individual was speaking. Each and every one of us has recognized, as we're talking to an individual, whether it's a family member or a stranger, in the very early components of a conversation, we'll say things like, "I'm sorry, is something going on?" Or "What's up?" We recognize when a person is down or they're a little depressed. All of those elements have nothing to do with the final vocalized speech or the words that are being spoken, or very little to do with that. They have to do with elements which we perceive that are underlying speech. Canary mines all of that information. And in mining that information, which is very, very rich, we're able to then build these models. So speech begins in our brain, in our central nervous system, when we have an intent to say something. When we're having a conversation like this, a lot of it's involuntary, and our mind is functioning at a speed that allows us to create language and words, both phonetic sequences and prosodic information that allows us to generate information through our central nervous system, control our muscular system, our respiratory system, and our vocal cords to actually realize a spoken word language and communicate something. But we communicate a great deal more than what the words are saying. We communicate a richness that includes excitement, emotions, a whole range of feelings that enhance and enrich the things that we are saying. Canary mines that information to provide the individual and their caregivers an augmented set of data that allows them to understand when they're depressed or when they're lonely or when they're isolated. These are critical elements in the treatment of people. So how do we do this? Well, one of the things we try to do is we try to deliver objective information rather than subjective information. If you're tracking things like stress and anxiety, we want to be able to do that in an objective way. So going back 4 or 5 years, Canary aligned itself with a number of clinical organizations where we did IRB-controlled double-blind studies in stress, anxiety, Alzheimer's, and depression. And from those studies, we used the standard systems for analyzing and assessing levels of depression or stress, for instance, as an example. And then from that, we did feature extraction from their audios in concurrently sampled vocal measurements. So we extracted the features. We had as a ground truth the clinical assessments, and then we built our models from that. And then we took those models once they were built and went back and tested them to validate them within that environment. We have ongoing studies in a number of hospitals in Japan, in Europe and Ireland, and in the US to validate and to improve and to provide information. And I'll give you some examples. I want to spend most of my time talking about the examples so that you can get a feeling for how this is being used in real time. So Canary has developed several tools to allow us to do this. We have an interactive app which you can download, or it can be downloaded from either Android or Apple. It allows us to configure that app with specific questions which may be desirable to the clinical or the caregivers, or specific to a condition or a disease that we're looking at. We have a speech engine which we developed over time, which has been customized to deal specifically in this area. We have a whole range of AI tools that allow us to look at data as it's coming in real time and filter out things that may be errants or noise. And then we took these models and we've commercialized them in a number of controlled environments, both in the health and wellness market, as well as in the clinical market. We're capable now of capturing a 20-second audio during an interaction with a person in their home or in a clinic, and then returning a score to that device or to a clinical data station within 3 seconds, and to do that accurately. So an individual can get in near real time from their conversation what their stress levels are. And we can follow them over time or longitudinally and provide them with an ongoing record. More importantly, we can also look simultaneously, not just at their stress, but how tired they are or how alert they are, and how that impacts on their cognitive function. So combining these things in real time enriches the type of information that either the individual has or a caregiver has in trying to assess the proper treatment and the next steps in an individual's care protocols. So one of our partners in the US is Hackensack Meridian. And we have a number of things ongoing with them, but I want to talk a little bit about congestive heart failure. At the present time, congestive heart failure across the country is a severe problem that we treat on a regular basis in our hospitals and in our clinics. As our population is aging, we see more congestive heart failure. It's just a nature of the natural aging process. However, individuals once treated are then followed at home because they're a significantly at-risk patient. Sadly, nationally, we have nearly 20% of the patients that we treat will have, within the first 30 days, will have an additional cardiac event, requiring them to return to the hospital, and often that return is significant. So if we can improve the quality of care as they're leaving the hospital and do that in their own home environment, whether that's a care facility or or they're being cared for at their home, if we can improve the quality of that care and reduce that 20% to something more acceptable down in the single digits, then we can extend the quality of life for these individuals, which is just critical. Mark talked earlier about his personal experiences. I would dare say I really hope all of us have had those experiences. When I was a young man living in Connecticut, my grandfather had a major heart attack and our family brought him in. He spent the last 3.5, 4 years of his life living in our home. It enriched the experience of all of the children, but in particular, it enriched my own life. I was named after him. He became my walking companion. Every night we'd go out for a walk, but we cared for him in our home. In congestive heart failure, there are several vocal implications that can be indicative of an oncoming event. Canary right now, in collaboration with Hackensack Meridian, are studying those events so that we can qualify them and validate them to provide additional information. So think of this as enriching this experience in a passive way. Individuals in their home are talking to us. And from that, we're able to analyze their voice and provide information that can enhance the quality of care. This is just critical. It's critical to use existing information that's already there during the time frame in which we're interacting with this person, and then enhance their lives and enhance the quality of care and improve both the depth of the data that we have and the accuracy of that data. Now, additionally, Mark gave just a wonderful talk about how we can provide a product in home or in facilities that enriches individuals' lives. We also have an opportunity to capture during that same time, without burdening the individual, information that comes from their voice. We can look at their loneliness. We can look at their cognitive function. We can understand from their voice when their thought process is cloudy. We could seek to avoid accidents by proactively working with individuals that are demonstrating potential problems. And we can do that in a passive way that just interacts with their normal day. Canary Speech, and this is my last slide. When you may ask yourself, how significant is it to advance speech? Well, Canary has been awarded 6 patents, 2 in Europe and 4 in the US. Our initial 2 patents received, both in Europe and here, 100% of their claims, which is rare. In this environment, there are hundreds, thousands of patents in the space. Our hope at Canary Speech is to advance this, to make it a practical technology in its application in serving individuals in the environments in which they live and work, where they love each other and where they're experiencing their family interactions, and to do that in a manner that allows them to have their life and not to unfairly burden them in the collection of information. We can do that using devices like Constant Companion has already commercialized. Bradley, I think that's my talk. It went faster than I thought, but I want to thank all of you for this time together. It's really meaningful to all of us.
Henry, that's great. I'm going to reclaim the host back, and I'm going to unshare the screen, or I'm going to attempt to unshare the screen. Let me see here. Well, I gotta be, okay. Well, can you, let me see. Stop
I
video.
can I can
Oh,
stop.
stop sharing. Stop sharing. Okay. It took me a moment to find it. Yeah, Henry, that was excellent. Thank you for sharing that. Um, I think the thing that's striking, just as I sit here and watch your talk, watch Mark before you, you know, we deal with a lot of different industries. We cut across a lot of different verticals, and I think one of the things that makes healthcare great, and maybe it's just the luck of the draw, we just ended up working with great companies in this space, like you, both you and Constant Companion, but just the humanity that you present your business with. You don't see that in every other sector. You don't see somebody talking about, you know, uh, their life and their experiences and how all of that manifests itself in the technology in many talks related to automotive or publishing or, you know, hotels. I think that that really distinguishes you, and I think that that's one of several things I thought was excellent about your talk. One of the questions, the question that's actually in this chat here, and I'm going to sort of phrase it a little bit differently. You started your slide deck with a slide that talked about all of the data points that you're capturing on each 10 milliseconds, or, you know, what is it, 254,000 data points per second. Does that vary across cultures? Does that vary much across different languages? The question was presented, are your models culturally sensitive? Um, do those data points shift at all based on different languages? I'm just sort of curious, or do they sort of stay constant?
Well, our experience is they're significantly constant across cultures. What we're really looking at are fundamentally how words are formed or created. To give you an example, we use AWS all the time, automatic speech recognition, and Canary Speech is a speech and language company. In the chat, one of the things we saw was, do we recognize keywords and things like that? And the answer is absolutely yes. However, if you think about automatic speech recognition, we can, in 165 plus languages around the world, with 99% accuracy, we can identify what word has been spoken when an individual is speaking that, whether it's in Chinese or Japanese or Korean or Italian or English. Scottish is a little bit hard, but we get there. And automatic speech recognition is utilizing the underlying features, like we are, to be able to 99% of the time identify in hundreds of different languages accurately from speech to text what's been spoken. So the underlying principle here is, if we utilize that same data layers, and there are multiple layers of data, and we're using multiple iterations of that. So we're looking at changes in time. So we're looking at things as they change over time. If we're utilizing the same data layers to look at what we already know is there, which is emotion and other elements that are central to how the central nervous system creates language. If we're doing that, and we already know in AWS or automatic speech recognition, it's 99+% accurate across languages. The inference to that is we will find the same. Now in Japan and in Ireland, with different accents and some different languages, Canadian, French, we see the application of our technology to be consistent across those languages so far. Okay.
No, that's great. And the other question, or one of the other questions that's come in, relates to what we've seen with COVID-19. Mark asked something similar in the Q&A here, and then this was asked separately as well. So we saw probably the most prominent, the effort that got covered the most by the media was what Carnegie Mellon did in essentially, and feel free to correct me if I'm not paraphrasing this correctly, doing work to allow speech, pattern recognition of speech, machine learning algorithms to detect if you have COVID-19 or have recently had it. Because according to some of the stuff they put together, your vocal cords, we know lungs get wrecked, and a lot of things happen, and apparently there's different ways to tell. What have you been tracking that? Is that something that Canary is incorporating? And what are your thoughts on being able to use technology like your technology or technology like yours to diagnose something like COVID?
And so we have been engaged in several different projects with COVID-19. The answer is that there are vocal implications, both at the word level and significant ones underlying that. The difference between how we approach it is, of course, we're a speech company, so we look at the vocal implications and the vocal level. But if an individual speaks 100 words, and you take those 100 words and you compare it to a database, you're working with 100 words. You may be working with some changes in tonal quality. You may be working with some spacing, but still you have a couple of hundred data points. If you take that same 100 words, we have 500,000 data points we're looking at, and we're looking for changes that then can be more specific, more rapid, and more accurate in how we analyze for that information. So in addition to that, once we've trained a model, the model is functioning independent of a database comparison. So if you're stuck comparing the words that someone spoke to 500,000 words you've collected or 500,000 audio samples you've collected, you're comparing what is being said now to what people have said previously who have a similar disease or who have had diseases with similar implications. What we failed to do, and the example I give is Agatha Christie. Agatha Christie is a wonderful example, a study that was done. She died with Alzheimer's disease. We had 40 years of rich literature from her. So we had large databases of her literature. Over time, we could see her words getting smaller, her sentence structure getting less complex. And over time, what we saw was, Agatha Christie was suffering cognitively at this point, and she continued to write after that. Well, I always tell people, Agatha Christie's vocabulary and use of language is here, and Henry O'Connell's vocabulary and use of language is here. By the time Agatha Christie got to me and she was demonstrating Alzheimer's disease, I'm still not. So if you're collecting audio samples from me and comparing it to someone like Agatha Christie, I look like I have advanced Alzheimer's and I don't. So we really have to go after more, and the information's available to us. We have to utilize the data that's already being used for things like automatic speech recognition, and very accurately being done. So Canary recognized that, and that's been our approach since the beginning. But we are born a speech company, and we were born in HIPAA compliance, and we were born in the clinical area. So those are the things I think that are important to the advancement of this into the future.